Hi guys, welcome back to my channel, that is Ma Vlogs. Today let's talk about good eyesight. Being a yoga teacher, I can tell you some pranayamas to improve your eyesight and delay diseases like cataract and glaucoma. But let's be realistic, with age our retina tends to deteriorate and we need some proper treatments. You know, my mom went through a cataract operation recently and it's a pleasure to watch her do all her regular activities without the hassle of wearing glasses. By the way, June is a Cataract Awareness Month and today I'm going to meet a very renowned eye surgeon, Dr. Cyres Mehta, and discuss this with him. Welcome, Dr. Cyres Mehta.
Hello.
Thank you for being here. Guys, Dr. Cyres Mehta is an award-winning eye surgeon and he's currently the surgical chief of India's most advanced eye center, which attracts people from over 25 countries. So welcome, sir.
Thank you.
Dr. Cyres Mehta, can you tell us a little bit about your experience and this establishment?
So I've been working for about 25 years since I finished my post-graduation, and this center currently has the best diagnostics in the world, and we have the most advanced laser systems for treating eye diseases like cataract and spectacle number.
So doctor, tell us a little bit about cataract and how does it develop?
Cataract is basically nothing but the human lens inside the eye becoming cloudy. When it becomes cloudy, light can't enter the eye, you can't get a focused image on the retina, and people see things as blurred.
And how does it develop?
So cataract is multifactorial. You can develop cataract because of old age, and that's what we all think, that people only get cataracts in old age, but it's not so. Cataract can arise because of metabolic diseases and because of infections in the womb. You can have cataract arising at 15 or 20. You can develop cataract if you have exposure to infrared rays, and finally you can have a traumatic cataract where if you have a blow on the eye from a ball or from a fist, the eye will respond by developing cataract.
So doctor, tell us what is the advanced procedure offered by your hospital for cataract surgery?
So in the olden days, we used to cut the eye open and press on the eye and get the whole cataract out in one piece. We don't do that anymore. Now we use minimally invasive laser technology. So basically a laser beam fires on the eye and melts the human lens. So once it's melted, we enter through a tiny tunnel made by the laser and we just suck out the melted cataract.
Doctor, you spoke about trifocal lens. What exactly is that?
A trifocal lens is very popular because it produces 3 focal points: far, near and intermediate.
So basically what you're saying is that if I have myopia or hypermetropia or reading issues, that one lens solves all problems.
Yes, basically.
So doctor, what is IOLs?
IOLs are basically an intraocular lens implant. This basically replaces the human lens. So that's why a lens was invented, to replace the human lens that were taken out of the eye, and this is called an IOL.
So doctor, we all live in a digital era and we all also want to have an active lifestyle. So somebody who has so much exposure to the screen and also wants to have an active lifestyle, which is the kind of lens you would suggest for them?
For this kind of requirement, I would always suggest a trifocal lens. In fact, I've been implanting trifocal lenses from Cyres for nearly 7 to 8 years now, and I've had a wide experience. We've implanted hundreds and thousands of these lenses, and basically they make the patient spectacle free. So the person will be able to see far, he'll be able to see near, and he'll be able to see intermediate distance, which is very important today in the digital age. Imagine going for a swim with spectacles or having to take out your spectacles every time someone phones to see who's calling. It's very inconvenient, and that's why implanting a trifocal lens like a Zeiss trifocal lens will really improve their quality of life.
So doctor, we've spoken about trifocal, we've spoken about IOLs. What is the kind of lens that a patient should look for when he's looking for a cataract surgery?
See Prerna, for example, would you be happy wearing spectacles? You would not. So this is exactly what people look for. They look for spectacle independence. No one wants to wear specs anymore. People from every socio-economic strata come to the clinic. It's not that only rich people or people with a lot of money need cataract surgery. Everyone needs cataract surgery given enough time. And everyone has the same requirement. They always say, doctor, put a kind of lens in which I won't have spectacles afterwards. So spectacle independence is very important to people, just as it is to you and me.
Absolutely.
You need to go to an eye doctor once a year for a checkup to rule out certain diseases that you may not even know that you have, like early cataract or glaucoma, which is an elevation of pressure in the eye. And these diseases can have long-lasting ramifications on your quality of life. If you lose your vision, you can't really function anymore. You can't work, you can't lead a happy life.
Yeah, absolutely. With the usage of screen nowadays, guys, we have to do an eye checkup from a proper ophthalmologist like doctor suggested, and not only go to like a spectacle shop. So thank you Dr. Cyres Mehta for this eye-opening conversation. And guys, for you I have a message: do not compromise on the quality of life and do take care of your eyes, because eyes are precious. And do not forget to post a picture with your parent or grandparent and support the hashtag Mission Perfect Vision.